A lot of the kids that we work with have not only a history of multiple placements, but may also have medical conditions, other special needs that you're going to want to address. What I typically tell families to do is to first start with their pediatrician, because anything that we're going to want to rule out, we're going to first want to look to see if there's something physically, medically wrong with the child that could be causing any kinds of symptoms or problems that you're seeing. So that's always a good, safe place to start. Or really any provider that you're already connected to that is doing any kind of assessment or evaluation of a child. You can mention your concerns to them, make them aware, but I would also recommend going and having a visit with the pediatrician, alerting them to what you're seeing and asking them for additional referrals, recommendations. Some of the typical referrals that I see here that we make are to the regional center. We do testing in-house, but a lot of places don't do that. But if you get connected to a place like the regional center, they'll test for developmental progression. How are kids doing? Are they meeting their milestones? And there are actually some good tools that can be used there. I believe through Easter Seals, they have online what's called the Ages and Stages questionnaire that you can actually do yourself with your child at home as a quick screener. That information gets submitted and you can get follow-up as to, with an indication of whether there's an issue for real immediate need of real immediate follow-up. But otherwise, you can go to a place like the regional center. They will do a full developmental evaluation and see, are there difficulties in this child's development? What are we looking at? Is this child looking like, they're developing language, their fine and gross motor skills are developing, their problem-solving communication, how is that all looking? And they can put together a plan with you around how to support that, whether that involves physical therapy, occupational therapy, speech and language therapy. They can provide all of that. Another common referral that we make is to what we call is the ISAM clinic, Infants of Substance Abusing Moms. These are getting to be, I think, more common in nature, basically specialty clinics that can look to see if a child may have been exposed to some kind of substance while in utero. You'll find staff who are better trained at looking for what kinds of symptoms and maybe some impairments that you might see or some difficulties that you might see in a child's development as a result of this potential exposure. So those are a couple of referrals that we typically will make, and it's really important when you do make those referrals or when you do connect with those places, you want to make sure that everybody is collaborating in getting services for your child and that they're working together as opposed to potentially against one another or minimally just without communicating with one another. So it's important to get authorizations to release information signed with each provider, allowing for the sharing of information across all providers. This can be difficult with a child who's involved in the child welfare system. You may find that you need the child's attorney or the court to make an order authorizing that release of information across providers. However, I definitely recommend advocating for this and really making calls to the attorney and trying to get this in place because it is in the best interest of the child and also will probably reduce the amount of stress in trying to connect with all these providers yourself.